If you're planning on a testing for meaningful use 2, there are 3 core measures that you may not have spent a lot of time thinking about. That's the requirements by CMS to report to your state syndromic, lab, and immunization data. Like I said, CMS requires that you report this to the state in order to obtain your attestation. That includes not just certification that you can transmit it to the state, which was a meaningful use 1 measure, but the ongoing requirement which states that you have to be able to prove to CMS that you have not only sent it once, but have continued to send it during your attestation period and after. What does this mean to you? Well, unfortunately, while CMS has mandated that you send this to the state, they have not mandated the way that the state takes it. And every state pretty much has chosen their own methods for receiving this information, leaving you in somewhat of a quandary. Well, this is HL7 data at its core. So you could acquire your own interface engine or other mechanism of transmitting to HL7, acquire your own HL7 developers, and change the messages to conform to what the state requires. However, that is probably going to require modification of the messages, filtering of the messages, repackaging of the messages, transport of the messages over a secure transport, and there's a variety of those that the states support, and then logging or recording for reporting purposes everything that you've done. That's a heck of a lot of work for the purposes of public health reporting when you have the business of healthcare to continue. The next option would be to go to a third-party provider other than obviously MedHost, and those could be anything from HIEs to consultants and contractors that would provide you with the same capability. However, you still have the responsibility, even with the HIE or your other third-party contractor, to provide the reporting to CMS and you're responsible for the submission. You can't get away from that. Or you could come to MedHost, and we offer a service called Your Care Link. Your Care Link is a concierge service. We take the messages just like kind of the UPS store takes your strange packages. We pack them up in the format that's necessary to send them to the state. We do that, and we provide you with all the reporting necessary to defend these 3 core measures against a CMS audit.